Case of the week. What would cause a 2-year-old, let's say little girl, to be irritable, tantrumy, just reactive? This little girl would also have sleep problems, really hard to wind down, waking up all the time in the middle of the night for whatever weird reason that made no sense, even though the parents were really trying to have a sleep schedule, the whole nine yards. Caused this little girl to have speech problems. Not that 2-year-olds speak perfectly, but above average speech problems with all kinds of pronunciation errors and just not talking well for a 2-year-old. What would also cause this kid to have other problems, like choking and gagging on the foods they eat? Tongue tie. A tongue tie can actually cause all of these things. Now, when you think of speech problems, sometimes tongue ties come to mind. And if any child has a speech problem, I sure as heck hope they've been checked for a tongue tie, because that could be one major reason why a child cannot talk. Because remember, you need this thing to move for us to actually be able to talk, right? And if this thing is not moving, guess what? Talking becomes a whole lot harder. What else do you need this thing for? Chewing, right? If a kid can't use their tongue, guess what they cannot do? Chew. Chewing and tongue movement are peas in a pod. You can't chew without your tongue moving. Just next time you're chewing, pay attention to how much your tongue is working to move that food around. And guess what? If that tongue can't move, that food is not moving around. And that's when you take a bite of something and you swallow it because you can't chew it. Hence why some kids only eat mac and cheese and peanut butter and jelly sandwich and one type of chicken nugget. Kids that do that and also had breastfeeding problems early on, and then 1 year of age or 2 years of age, they were choking and gagging. I would be willing to bet $100 that kid has got a tongue tie. And you know what? If Vegas had those kinds of odds, not that I like gambling at all, it makes no sense to me whatsoever, but if Vegas was like that, I would be going there just because I know I would be making a lot of money. Breastfeeding problems, choking and gagging on food, being the picky eater, those are all signs of a tongue tie. But it turns out that tongue ties also cause airway problems. So these kids can't breathe very well, which causes them to have sleep problems. And because these kids aren't sleeping and their entire digestive tract is off, and they also oftentimes have a lot of tension, not that a 2-year-old can tell you like, hey, my neck is tense. They have a lot of tension in the back of their neck because guess what? This powerful muscle that can actually generate a lot of force is constantly yanking on what? The back of the neck. All of this is connected via fascia, this elastic tissue. So you've got this muscle that's just yank, 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 yank. Tension in the back of the head causes a lot of irritability in kids, except they can't express it. Now, in the case of this little girl, we won't even give it her name, but this little 2-year-old girl, what was so cool is she went and had surgery with a very competent ENT who did a fabulous job releasing the tongue and really getting in there. And they did a bunch of therapy to make sure the tongue was moving, because it's not just snip, everything is better. You've got to get this tongue that's essentially crippled. Like imagine like you're shackled to your desk and you haven't used your arms in years. Are you just going to be able to lift the thing up? No. You need therapy to get the arm moving, to get the tongue moving. And then once you do that and they do the surgery, all of a sudden, really cool things happen. Little girl stopped choking and gagging on food. And all of a sudden, 2 months later, the mom's like, oh my God, she's trying foods that she never did before. Why? Because she can actually chew. Imagine that. You can chew. Now you can eat other foods and may actually enjoy other foods because you're not gagging on them. You're not afraid of these foods killing you. So you eat the only foods that don't startle you every time you gag and eat. She's suddenly trying new foods. Her speech became so much more fluent. The mom is like, oh my God, she's talking so much better than before, and she's talking more. And the coolest part, she started sleeping better, sleeping soundly, falling asleep easily. And then all of a sudden, all of these 2-year-old tantrums were gone. Yeah, the kid reacted. 2-year-olds react, 3-year-olds react. It's part of the game. But she wasn't losing her mind. And these are the things that are so cool. These kinds of things are there all the time. If this was the first case I'd seen of this, it'd be like, oh my God. No, I've seen probably hundreds of these, if not at least 40, 50, 60. I've seen a lot of these. And the cool thing is, in older kids that can actually talk to you, when you ask them, like, how do you feel? They're like, I feel so much more relaxed. The headaches they were having before, the neck pain that they were having before, gone. These things are possible. We just need to know that they exist. We just need to know that this information exists. And I feel myself completely blessed because I've just been lucky enough to have some of the smartest teachers I could possibly ask for. You saw in a prior video, Sarush Zaghi. My God, that guy is awesome. He is so smart and he's so good at what he does. Diane Barr, holy Jesus, this lady is just a fountain of information. Go check out her work. It's incredible what she's doing, and I'm lucky enough to have worked with her. Dr. Sherry Sammy in Agora Hills, awesome. She understands this stuff, and Dr. Gila Robbins and Dr. Pinto, all of these incredible people know so much about this thing. And I've been lucky enough to be able to learn from all of these brilliant people and have them impact how I see things. And that's the whole purpose of these videos, to share with you what I've learned from all of these incredibly smart people that you've probably never heard of. Because we just think of like, oh, well, she's just having tantrums. And oh, yeah, he's just a little slow to talk. And, you know, some kids just don't grow. We just say these things and just brush it under the rug. Why? Because we don't know what else to do with it. But this is what else we can do with it. And I need your help to get this information out there. Everyone needs to be hearing of this stuff. Everyone needs to be thinking about this stuff. And the information is all out there. Like this isn't, I'm just pulling something out of my fill in the blank. This is all information that is readily available. This is information on PubMed. There's books that have been written about it. All of these smart people have been talking about it for a long time. Unfortunately, they have just not, their message has not gotten to you. And that's what I'm hoping to do. Thanks for watching. Please share this. Let's get this information out there and make the world a much better place for these little people and maybe the big people too, right? There's so much chaos and just craziness happening. Let's at least bring some light into the stuff that we can control. Be well. Thanks for watching. This is Dr. K.